As always, we are creating community here on WPPX Channel 61. Listen to some of these statistics. This is released by the Census Bureau. The number of uninsured Americans, and I'm talking about uninsured health and the health situation, stood at a record 46.6 million in 2005, with 15.9% of Americans lacking health coverage. That is scary. When you think of the alternative, that first of all, it's your life, it's your health, it's your body, it's you. But today I want to introduce you to two wonderful people who are doing something about it. And they are in the medical profession, and it is my honor to introduce to you, first of all, Dr. Gary Saltzman. Gary, thank you for joining us today, too. I really appreciate that, because you are really the thrust behind this concept called family medical management, correct?
Correct. Michael, thank you for having us on your show today.
And I think everyone out there is going to be very surprised when we finally tell them exactly what this is about. Really, don't leave where you are. But you also brought a very, very lovely person with you as well, who I gather is probably one of the strengths that you rely on as well. Is that correct?
That's correct.
Okay, who do we have here?
This is Angliss. She's one of the physician assistants in my practice and the person who helped me put together my family medical management program.
Right. Angela, how long have you been with Dr. Saltzman?
Well, about 15 years now.
Wow.
We've been working together ever since, trying to help the community as much as we can.
Yeah, I do want to mention to the folks at home that I had a chance to meet with Gary. You don't mind my calling you Gary or Dr. Gary? I don't mind saying this. What I'm going to present to you today really is something that comes from this man's heart, and I know this, and I have no problem saying to you that this is something I really believe in and would support it in any way possible. First of all, let's go over in a general way, Gary, what is discount family medical service plan, I guess is the way to put it.
Family medical management is a discount medical plan where people can access health insurance for a set price per month. We set out and we made the program very affordable so that we could help our patients that we see every day. We have occasion every day in our lives as physicians to see patients who can't afford to have testing done. They can't afford to see the doctor. Their children cannot be immunized.
And that, actually, when we had our discussion the other day, you said that really bothered you, didn't it?
Absolutely. I mean, we tried to get the children prepared for school to prevent them from getting infections and diseases and prevent them from contracting meningitis. And this program helps put all of those things together.
I think, Angel, I just want to ask you this question, too. I think most doctors enter the profession with a sense of duty to their patients. I'm sure that they do. But with this way the system is now, it's almost like get them in, get them out. It's almost become a turntable of patients. Did you see that too? I mean, I didn't realize you were with him for that long, but I mean, do you see that happening in the medical profession?
Absolutely. It's just a routine. Normally, people come in, they leave, they come, they go. And people get lost in the system. They don't realize that there are people out there that actually care for them. We always care for these patients. I mean, I talk from my heart. We always wanted to be able to help all those people out there that have no sources, no doctor to take care of them. And we wanted to be able to do something together to bring this forward.
Situation. Gary, do you think that in terms of this, that what do people do when they can't afford this? I mean, do they put it off? How do they live like this? I don't understand it.
It's very hard for the patients. For example, we have patients in our practice who can only afford medication for a month. So they wind up taking the blood pressure medicine every other day to make it last for 2 months.
And that's incorrect, really. That won't do anything, will it?
It only half helps.
Right.
And when the days they take the medicine, it lowers their blood pressure. But we're looking for people to take their medicine on a consistent basis, so to make it affordable for them to be able to do that.
Right. Now, I want to make sure that we keep punching this number, because I think it's important that they do. The number where you are is at 215-669-3722. Correct?
That's the correct.
Okay, correct number. Now, let's go back and let's talk a little bit about the cost, because I think this is what's really going to blow people's minds. What is the cost for coverage in this particular situation?
For up to 5 family members, it's $150. And that includes...
Say that again, because I first time I heard it, I went, what? Really?
For up to 5 family members, it's $150 per month.
Right.
That includes unlimited medical office visits to one of our participating offices, and we have 5 medical offices in the city.
Unlimited visits.
Unlimited medical visits. They can come in every day if the patient's sick.
Now, how about a single individual?
A single individual is $75, and we don't have any type of copay associated with that. So that's the fee that's paid for the family or the single member per month. They don't have any other out-of-pocket expenses.
Angela, when people come to this, I know this is basically new, isn't it?
We're the only doctor's office in the city, and I would believe in the country, who is offering this program. There's other discount medical plans in the country, but none of them are offering the primary care visits for free, and that's essentially what we're doing.
Okay, and I just want to make sure we understand, too, that it does not include hospitalization, though, correct?
It doesn't include hospitalization. We're not an insurance company.
Right.
And by not being an insurance company, we actually can help people better. When people have traditional Blue Cross insurance or other types of insurances, they can be taken out of being accepted for the insurance.
Right.
And with ours, everyone is accepted. We don't have any patients that what we call pre-existing conditions. If you have a pre-existing condition, if you have diabetes, if you have high blood pressure, if you're on insulin, you can still come into our plant and be taken care of.
Right.
No one's excluded. Everyone's welcome.
It's amazing. I want to get your reaction when people first heard of it. I was talking about this, I said it was relatively new. It's about a year old, right?
We've been doing it now for about 4 months.
Or 4 months, yeah. Wow.
4 months.
So we are on the cutting edge here, folks. We are on the cutting edge. And so when people came in and you present this plan to them, I'm sure they got excited.
Absolutely. They were so excited to know that they can actually have a family doctor now.
Right.
They have a family physician to take care of their whole entire family.
And
that's the key thing. They have a doctor now.
All right, we're going to come right back, and we're going to talk more about that and how the patients react and other aspects of the plan after we take this break. And you are on ION in Philadelphia and the surrounding communities. Yeah, so I know I cut you off a little bit about it, but are people in disbelief that you could do this?
Yes, they really are. I mean, they come to the office and I explain to them, you can come in and you can treat your entire family for $150, and they say, everybody, and say, absolutely everyone in your family, as long as they're in the same household, they can come see us. And they're absolutely blown away.
I would think so. And it's up to 5 people, right? What if there's a family that has even more people? How do you work that out?
Well, if someone has an additional person to add, we charge like $35 per additional person.
I mean, I feel like I've taken a step back in like 30 years, and when my family doctor used to charge $5 for a house visit, right? And I remember my mother saying, "Can you do it for 3?" But this is exciting. Let's look some more at the data that's out, and I'm sure it wasn't the data that motivated you, but it was the concern that these people walked out and you knew that they weren't going to be protected as well that they should. Is that right?
That's right.
One of the figures here, it's sobering that 5.4 million more people lacked health insurance in 2005. That's an additional. And this in the recession year of 2001, primarily because of the erosion of employer-based insurance. That's also been a problem. So we're not talking of people that are poor either. We're talking of people that just can't afford the high cost of insurance.
Absolutely. It comes down to a lot of times the people buying food or seeing the doctor, and they have to survive, so they get food. But our plan is so good that because we provide pharmacy benefits for the patients for $5 and $10, we have generic prescription plans. So when people are taking medication, we can make it affordable for them. they'll be able to take their medicine every day. There won't be any excuse not to take your medications.
Now I know that some of the large stores like Walmart, they're all now saying, well, we're going to offer generic drugs for $4 or $5, whatever it is. You were actually thinking about that before this came out then?
Well, we've been doing it now for 3 months.
Right. So how come, I don't want to go into why it hasn't happened that way, but now let's talk about the specifics of the plan just a little bit if we can. So you get, for $150, it's up to 5 family members. That's like $30-some a person, right?
That's right.
Then people are going to say, well, how do you make your money? You know, you got to survive. You have people to pay, and, you know, places to keep up. How do you do that?
Michael, we're not interested in making a huge profit with this program. Right now, it's running at a loss, and we're fine with that until we enroll enough people to make it balance. But I see the benefits from the people that I'm helping, and that's what I'm so excited about.
Right. And I think I said to you earlier, too, and I meant this for both of you as well, that it fascinates me that you're doing this really from your heart. And there are 5 locations also, correct? Do you know off the top of your head what those locations are?
Yes.
Okay.
We have an office in the Northeast. That's 3500 Vista Street. It's in Mayfair area. There's another 2 more offices are in Germantown area. That's the True Charlton Medical Center in the Charlton Medical Center. And we have one in Southwest Philly. That's 53rd and Chester Avenue. And our last one is on Lansdowne Avenue, the Lansdowne Medical Center, which is at 60th and Lansdowne.
And you did this all without cue cards. I'm looking at the cue cards that you did without.
I've been working all these offices for the last 15 years.
Wow. Now, how about services like blood work? Is that extra, or what's included in this particular service?
After patients have been enrolled in our program for about 6 months, we offer free blood work. If someone needs it right away, we can discount the blood work to make it affordable. And that's the key point, making the services affordable for the patients.
Right. Do you do the blood work right on the locations too, or do you have to send that out to a lab?
Well, we draw the blood on location and we send it out to a reference lab.
And when you picked your team of people, of doctors, how did you pick them? In other words, they have to be very, very special people. But I want to hold that off the answer. I'm going to use that as the hook to come back to our next segment. So, I just want to know how you went and picked these particular doctors as well. Okay. Did you have something to do with it too?
Well, I'm one of them.
Oh, okay. I was hoping you'd say that. All right, but we're going to be right back. Thank you for creating community with us. You are on ION. Hang in there for the other side.
This is a true.
Normally what I do is I give you our numbers and you see them on the screen throughout the show. That's terrific. I'm going to go through them real fast. If you want to contact us, and we'll forward any information on to Gary and to Angela. Our phone number is 856-963-6400. Our fax number is 856-964-3291. Our email address is ion@omni2000.com. And our snail mail address is 413 Cooper Street, Camden, New Jersey, 08102. Terrific for these numbers, but I want to tell you this one number, you got to write this down, and you got to follow this through, and I'll tell you what people are basically eligible to do this. That's 215-669-3722. Doc, give it again.
215-669-3722.
Angela, give it one more time. Okay.
215-669-3722.
Terrific. Okay. And you'll see it up on the screen. You can continue writing it. We left off with, how do you choose doctors that are willing to work at this particular... A lot of doctors feel that, they have to make a lot of money to survive. But these are very special people, aren't they?
Oh, absolutely. The doctors and physician assistants that work with me are very special because they want to help patients. Mm-hmm. They come into areas which may be unfamiliar to them, and they're able to adapt and listen. And when I say listen, the doctors that I have are very good listeners.
And something I was told once by my brother, he said, you don't show your intelligence by speaking. You show it by listening, and that's true. Now, we got some information out of you in that last segment as well, because actually by law, you are a physician's assistant here.
That's true.
But your training is much deeper than that, correct?
That's correct.
You are really doctor.
Right, I have an MD.
Right, okay. And it was interesting because you didn't just volunteer that. You came out and I sort of found it out through the back door. And it's just a wonderful thing that you're dedicating yourself to this particular concept. Who are the people that would benefit most from this plan? Obviously people who can't afford, okay, but it's not just a matter of people that are just poor. These are people that are what?
Well, these are people that have no insurances, or they're in between jobs and they don't qualify for insurance. So they need something in between to help them carry over. And also for small businesses, people who have, they want to provide their employees medical health.
Right.
And it's a very low cost, very affordable for an employer to be able to give that to their
I was
employees.
going to ask that. What is the cost for a small business then?
It's the same.
Same thing?
It's the same thing. We offer the family rate for $150.
Right.
And it gives the employees peace of mind to know that when they go to work and their family or their children get sick, they have a place to go and get medical care.
Wow.
And that's important.
It is. And are there discounts involved in this program too? I mean, for other things?
Oh, yes. We have a discount plan for dental care, which is a really, really good plan. We work with a group of dentists who will give affordable pricing.
Right.
We also have a eye doctor who can provide glasses and contacts and LASIK surgery for discounted rates.
Right. Now, somebody at home is going to stop and they're going to say, well, okay, this is great, but how good are these professionals? Did you evaluate them?
Absolutely, I know all of them. They're top-notch.
Okay. And they have the same kind of heart that you and Angela have in terms of this is really because you want to be of service to people. That's why you went into the profession, right?
That's right.
Okay. How about children?
Children are part of the plan. Like I said, we can do the immunizations, we can do well child care. We don't have any type of co-payments for the family, so money's not an obligation when they come in. We have several children in our practice who probably would not have been able to get immunizations if they weren't part of this plan.
How do you figure in this country, we're an abundant country, and yet the cost of medical care is almost getting out of range for even the average middle-class person to afford, isn't it?
Oh, absolutely. It's astronomical right now for families to buy health care. That's why we had to come up with something different, an alternative for people to get medical care, and that's what family medical management is about.
All right, now how do we handle hospitalization and emergency care? How do we do that?
Well, at the moment, we don't have hospitalizations or emergency rooms.
Okay.
So that's excluded right now. Hopefully in the future, we'll be able to come out with a plan to incorporate it.
Right. And when you think about it, you've only been in business with this for 4 months, or in practice for this for 4 months, and all that you've been able to gather together, it's almost like a magnet of really very special people. Do you think there will be a way for hospitalization to be included in this in the future?
Yes, I do. I'm working on that now with a group. We're in negotiations and trying to come up with a program for that.
And I know we covered this sort of in an indirect way. Angela, what if I needed a specialist?
We have a group of specialists that we refer to who are also caring physicians. They'll give them medical care for a very discounted cost. It's very low for them, and we actually make the arrangements for the patient. They don't have to go out there and look for these patients. We actually make the calls and make the appointments and set it all up for them.
In terms of the services that are involved in this, can you just give me a quick rundown as to what's included? I mean, I wanted to also, before we answer that, what about the elderly care? Can that be included too?
Absolutely. We have patients who don't have any health insurance. They may be from different countries. They may not be eligible for the Medicare program. They're in our program. We provide them with any type of medical care, including flu shots and pneumovax shots.
Because I know that when people start getting to that age, okay, and they become pretty much confined to a fixed income, it really becomes difficult, doesn't it?
Oh, yes, it does.
It would be difficult.
We can follow them closer because they can come to our office within that month as many times as they want to for no extra cost. They could be there 10 times in the month. Doesn't matter. We'll still see them.
That is amazing. All right, let's give the number again, okay? And you want to give it first?
The phone number that you have to call is 215-669.
Okay, there was another number you had, 3722. Is that the one?
669-3722,
right? Okay. And you want to give it again?
Yes, the number is 215-669-3722.
What was that other? We won't ask you what the other number is, right? Man's got a great sense of humor, too. That's terrific. Thank you both for joining us today. This has been very helpful. I'd love to have you come back, and we'll go into more detail in terms of the services that are provided, okay? Thank you for joining us on ION, and also thank you for helping us create community here on ION.